See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
Welcome to See You Now. I'm Shauna Butler. The Neonatal Intensive Care Unit is not a place most parents anticipate meeting and caring for their newborn. But when they do, they find it a place where science, technology, tiny humans, and strong emotions meet head-on. It's a place where you'll meet the most talented and highly skilled hospital staff. It's also a place where nurse Nicole Lincoln spends a lot of time supporting the innovations of those nurses cradling these fragile little lives. But her role dramatically changed in early March when COVID hit.
One day I was in a resiliency program with the nurses where we learn all about how to care for ourselves in a stressful job. And we knew something big was coming. It was in the air. And then by the next day we had our first COVID patient, and it was boots to the ground, getting the whole organization ready for this. And it just seemed to all happen overnight on that first weekend, right around March 10th.
Little did we know when we talked with Nicole that March 10th would be an important piece of the epidemiology puzzle. On August 25th, the Boston Globe reported on a new study from scientists at the Broad Institute of MIT and Harvard that estimated that the large international conference held in a Boston hotel in late February played a far greater role in spreading the coronavirus than previously thought. The event drew attendees from across the globe and took place before many Americans really took precautions against COVID-19.
The article is surmising that upwards of 20,000 people got COVID from that one conference. It really explains the surge that we saw in Boston because, we had some of the earliest patients in the state, and we filled up quickly and surged right through the beginning of May. That really gives us insight into the importance of adhering to the guidelines around COVID and understanding why it's so important not to have large gatherings, because it can affect a whole community.
The deeper dive into the epidemiology of COVID-19 reveals how incredibly connected we all are and how vulnerable populations are disproportionately affected. Nicole Lincoln is the Senior Manager of Nursing Innovation at Boston Medical Center in Massachusetts. And on this episode, we talk with her about the initial flood of COVID patients in the Boston area, how her role changed overnight, and about innovating for the needs of our newest and youngest citizens. I'm Shauna Butler, and this is See You Now. Stay with us.
My name is Nicole Lincoln. I'm a nurse, I'm an innovator, and I'm a thought leader at Boston Medical Center. Boston Medical Center, it's an academic medical center, and it's a safety net hospital. And that means that we serve a population that is low income, very diverse, a lot of homeless, riddled with substance use disorder issues. And we're a level 1 trauma facility, so we also see all of the trauma from the surrounding Boston urban area, but also flown in because we're the largest level 1 trauma hospital in New England.
And you have a particular role as an innovation lead. Say more about the role that you're in.
So thanks for asking about the role that I'm in, because I think it's a pretty exciting role that nursing's been adopting in recent years. I work as the Senior Manager of Nursing Innovation. I see this role as one that gives visibility to nursing ideas across the organization and really highlights the contribution that nurses make to innovation and quality improvement and patient safety. And so I'm able to tap into the small groups of frontline nurses on each unit to get their ideas on how to solve healthcare problems and really revolutionize the way that we give care. And I also see my role as connecting the nurses to others on the team and bringing their value right up front and showing what they have to add to each and every forum across the hospital.
How did this role get started and when did that happen?
So my role at Boston Medical Center developed and came to fruition about 4 years ago. I was working as a nurse educator at the time, and I had started working with the nurses on my units on some new workflows that were aimed at improving patient safety. And one of them was to prevent falls in patients, and we were able to reduce falls by 76% on the unit by making geographic pods where the nursing assignments were geographic. And the other one was really around communication and bedside handoff. And the results from those quality improvement projects were pretty significant. And the chief nurse at the time wanted to spread those innovations hospital-wide. So she developed a manager of nursing innovation position. And since then, we have done so many exciting things. So my whole job, which is like the best job in the world, is going around to nursing councils and nursing groups and working with each of them on their idea for improvement. And then we also, the chief nurse and I, we had a nurse tank, which was like Shark Tank, but nurse tank. And 60 groups of nurses came together with ideas of solutions to improve the care for patients at the hospital. And they went before the board of directors and the CEO, and 10 of those projects were funded. So then part of my job is to help the nurses to implement those projects. It's great because since my position began, it really gave nurses a voice in the hospital, but it also gave them a seat at all of the interdisciplinary meetings where they were never invited before. And I can remember a couple of times when I got nurses applying for the safety grants, because each year at the hospital, there's an application for safety grants where you can be funded up to $50,000 to work on a project. And one year we had 5 out of 8 of the projects, and nurses had never had projects before in this arena. It was very hierarchical. It was physicians and it was maybe pharmacists. And so I think I gave nurses the courage to just feel like they can make it happen. And so that's kind of where my position has led. And then when COVID came along, it was like turn my position upside down and dump it out, because it was then about really redesigning the whole place with the nurses to accommodate what we were dealing with. And it was fast. I had somebody say to me, "You guys just did 2 years worth of work in 6 weeks." We opened hospitals, we opened units, all through it all, as we're crying because we're looking at something in front of us that is just so painful that we've never seen before.
COVID. Back in the spring, when COVID first really descended upon you guys, can you describe that transition? I mean, was it something that happened all at once? Was it trickle? What was the curve like of taking care of COVID patients?
The curve was like a sharp incline. It was like, I remember one day I was in a resiliency program with the nurses where we learn all about how to care for ourselves in a stressful job. And we knew something big was coming. It was in the air. And then by the next day we had our first COVID patient, and it was boots to the ground, getting the whole organization ready for this, transforming our footprint, our units, where our patients would be, because we needed to make sure that we kept the COVID positive patients separate from the non-COVID patients. And so nurses were also reassigned to different units to work. And it just seemed to all happen overnight on that first weekend, right around March 10th. And so it was kind of wild, because then I became the COVID nurse innovation guru overnight. And I had to work with all of the nurses at the front line again, because they're the only ones that really can know what to do on how are we going to approach the fact that no visitors are allowed? How are we going to isolate these patients safely? How are we going to train the ancillary staff like phlebotomists and housekeepers and transport? And I even say doctors, how are we going to train them how to safely use the PPE and to preserve it? Because never before in history have we ever really needed to think about preserving and stewardship of personal protective equipment that you wear to keep yourselves from getting infected during coronavirus. And we really didn't know much about it. So it was really boots to the ground, looking at the CDC guidelines, looking at how much PPE we had, which was a daily thing because it wasn't a given anymore. It was a really frightening thing for everybody.
It really exposed a lot of the fault lines that we have within our care systems, particularly those who are most vulnerable, who have the least access to care. You were mentioning that you have an incredibly vulnerable population as a safety net. At the moment in time when you were thinking through all of these details, what was the thought process like about making sure that our most vulnerable, maybe some of our tiniest patients and citizens, our youngest ones, how are we thinking about taking care of their needs? They have a very specific set.
Well, I'm glad that you asked that question because that was a whole nother part of this, because mothers were going to be giving birth during COVID, and we really didn't even know if babies were going to be catching COVID during birth and what precautions we would need to take. And it was a very scary time, I think, for the mothers giving birth. And we had to also think about isolation. And it's interesting because before COVID, I had been working on some really awesome innovation around incubators with BC Scientific. And I was their nurse advisor and was pulling nurses from maternal child health together to advise BC Scientific on a new incubator that they had created. But the interesting thing about it was the housing for the baby is disposable. And so therefore, there would be no cross-contamination between babies if you use that incubator. And traditional incubators, it's arduous. You're cleaning them. They're like, think of them as like a RV or a trailer. They're big and they're bulky, and in between infants, you would disinfect them. And so I started to think about that innovation that I had been working on around incubators with NICI, which is a new, much less expensive portable incubator. And I started to think about, wow, could this be used in COVID? My partners in BC, they started to think about, could this be used for housing of a patient's head during COVID, this isolette? And so we started testing that during COVID too. So that was really fascinating and interesting. And so proceeding with that, I think we need to come up with innovative solutions in this pandemic to be able to manage the spread of it.
What was care like for newborns and moms prior to COVID if they ran into problems, if there was a preterm birth? Let's start there.
So we have a Neonatal Intensive Care Unit at BMC where I work. And prior to COVID, the nurses have been using a traditional incubator to house those infants in during the period where they might need humidification, oxygen, supplemental oxygen, or phototherapy or things like that would treat them until they're ready to be out of the incubator. And those incubators, by the way, are like dinosaurs. They haven't changed in over 100 years. They take up a lot of space. They're really very expensive, coming in at over $100,000 for each unit. And they don't meet the needs of today, especially with COVID, because you're reusing the same incubator for the next infant that comes along. And so there's a lot of time spent cleaning them, and they aren't able to connect to the data, to dump data into the electronic health record because they haven't been updated from a technological perspective. And so they work to deliver the supplemental O2 and the humidification, but they're just really not practical. They're out of reach for anybody in the third world country. And to tell you the truth, we've lost so many rural hospitals in the U.S. that they aren't practical there either. NICI is an incubator that can deliver all that the traditional incubator can deliver and more. NICI can be used in an ambulance. The disposable housing comes in a small package that could be stored easily on an ambulance, and the motherboard or the control board, it can run on battery, it can run on solar. Even in the hospital setting, it uses so much less electricity than a traditional incubator. And like I said earlier, the cost of it is a fraction.
The very first time I saw the NICI, I thought, it looks like a clear plastic umbrella. What is more portable than an umbrella? I mean, when you need to change your geographic footprint, an umbrella really does that. It goes from being so portable to all of a sudden it covers a very large footprint. So that's brilliant.
Yes, that's a really good comparison, because the NICI housing for the baby folds down into a very small portable unit. For instance, a midwife could just have that right in her vehicle with her and be ready to go. And she could use it if she needs it, and it's efficient. She doesn't need to open it if she doesn't need it.
Yeah, there's a certain Mary Poppins quality to it that I think of the midwife with this, magic bag, and inside of it, they just keep pulling things out that then create this much bigger space and take up a much bigger volume than would you'd be deceived by in looking at this bag that has all of the equipment that they need. The neonatal intensive care units, we've seen just this crazy set of circumstances. I mean, who would have ever thought that we would have COVID maternity units? But in places where we've had this huge amount of community spread, we've got women coming into labor who are also testing positive for COVID. And that changes how they're going to deliver. And then after they deliver, where that baby goes. Those babies who are coming early, we have not been able to have the same level of interaction with families in our neonatal intensive care units. As I'm listening to you describe this, I'm thinking NICI has this really important role to play at this point in time that would allow for the type of care that some babies need right after they're born. Maybe we can send them home. Walk us through what possibilities exist.
So we did have actually an average of 3 mothers COVID positive giving birth a day at my hospital during our surge. And so there is an absolute need for a product like NICI. And I think going forward, the world has changed forever, and we're never going to go back to the status quo. I mean, NICI solves so many problems in the neonatal intensive care unit. The units are to be used for 1 week and then disposed, so they're never shared between infants. As far as going home, I think about the rest of the family and their COVID status. So if you wanted to discharge a COVID positive baby, or one that was being ruled out for COVID for that 14-day period after birth, the NICI could be a solution to bring that baby home and then just have the interaction between the mother who's known positive and the baby, and have them isolate in a room in the house or something like that, so that she could be home and have a more normal birth experience. And you're 100% correct in thinking that the birth experience for mothers has changed dramatically during this pandemic, and it has not gone back to the status quo, and I don't think it will be going back for a very long time. And so we need to develop innovation around connecting families through a birth, because it really just is not normal for mothers to give birth in isolation. And I do think the NICI could help in its ability to isolate the baby and reduce transmission of possible COVID, so that families could in the future still come to see the baby and bring back some sense of normalcy to the birth.
How does a portable, low-cost, disposable incubator help us to address the maternity care deserts and the health care needs of rural areas or low population density areas?
Number one, it's clinics, because in those rural areas, that's all that they have. So the NICI can actually be at the clinic. And then the other thing is ambulances. I envision a NICI being in every ambulance. And then also the home care setting. Visiting nurses could care for a vast majority of the needs of neonates right in the home if they had something like the NICI. There's great potential for not your 23-weeker infant who is very, very sick, but for a stable infant, they could be in the home setting with the NICI, with a visiting nurse checking in. And the financial implications, the cost reduction from doing care like that would increase access for so many infants, because the cost wouldn't be prohibitive.
You made the comment that with this portable incubator with the form factor that looks a lot like an umbrella, you were seeing that there might be an application for COVID patients, adults specifically. Walk me through that discovery and how you guys were testing that to see if that would be something that we could use in treating patients with COVID.
Yeah, I mean, it really is exciting. So you can take the NICI and you can take that control panel off of it. And what you have in that disposable infant housing is an isolate. And just as in the NICU world, it would reduce the risk of transmission of infections because it's a one-time use for one child. And so it actually dramatically reduces the risk of hospital-acquired infections being transmitted from baby to baby in a NICU setting. So that kind of led us to think about, wow, could that housing be used over the head of a COVID patient and reduce transmissibility of a COVID patient, changing it a little bit. But all of the elements were there. You know, you're delivering supplemental oxygen. You need negative air flow and air exchange. And you need to be able to isolate that head of the individual because that's where the transmission occurs through sneezing, coughing, and such. It would need to be obviously comfortable on the patient. They can't be feeling claustrophobic. So a lot of the testing that we did was really on taking that adapted, shaped isolate housing, which is very similar to the NICI housing, and putting people inside of it, delivering oxygen to them, and measuring the air inside of the isolate, measuring the tolerance of the people that were going inside. But it's also really unbelievable because Breegee built these kind of armholes so that a clinician can get inside that isolate to intubate the patient or give patient care without breaking the isolate feature of the unit. So it's really amazing.
What are some of the other epiphanies or like discoveries of a current approach to something that was converted to address the needs of a COVID patient or a situation where we have a highly contagious respiratory illness in our communities?
It's kind of sad that it takes a pandemic to get so many ideas going, but that is the silver lining of a catastrophe or,
it's an innovation hotbed.
Yes, it is. And so everybody's working on something. And, in the whole team's engaged, and there's innovation around communication because, like I said, that's huge because the families are separated. In those early days with our boots to the ground, we used baby monitors to be able to talk to the patients when we weren't in the room. We had some great nurses who got tons of pictures of the family to make sure that the patient had their family with them too. Then it was just like a nurse created a hard box to intubate a patient within so that the secretions wouldn't come flying up towards the anesthesiologist who was intubating. And that led others to think of other models, and everybody just really wanted to help. And I think sometimes people in this felt powerless, the people that weren't at the bedside, such as nursing administrators or hospital administrators, they felt powerless because the people at the bedside were the people with all the power because they were making the changes in real time right then, saying, oh, no, this is not going to work anymore, and we've got to shift to this, and coming up in real time with a solution to meet the needs of the patient. And it was just so different than anything we'd seen before.
The way you're describing that really has turned on its head the way innovation has been driven before. And this is being driven where it's closest to the problem and a lot less far away from executive levels. The way you're describing it, that's what I'm envisioning.
That's exactly what I'm saying. Historically, companies in isolation were making products for the medical world, and then buyers in the hospital, in procurement and value analysis, were purchasing products to be used at the bedside without consulting frontline workers. And that just created a system of waste, a system where over 30% of what you do on the unit is non-value added. And that's a lot of what I worked on with the engineering students, was identifying what things that we do that had no value. But you're right, it tipped it upside down. And more innovation happened, like that comment, wow, you guys have done more in 6 weeks than could have been accomplished in 2 years before this happened. And it's just because all of the barriers were removed, all of the red tape, all of the bureaucracy, all of the things that keep you from moving forward in your innovation process.
Has COVID changed the way you think about innovation?
Definitely. Prior to COVID, you felt like you had time to innovate. You felt like a lot of the nurses didn't have the courage to stand up and think of themselves as leaders or innovators. And now post-COVID, what I see is that nurses know that they are thought leaders, and they know that this pandemic, they were the solution makers, and they now have the courage to be innovators in any field, in any part of healthcare, or even just in any aspect of their life, because that's what truly inspired me, was that nurses, they were the heroes, but they were the heroes because they were the ones who didn't turn their back and just ran in head on and just did the innovation right there and then at the bedside. Of course, in collaboration with the team, but I think it gave them so much courage, and I see them standing so tall because they took a lead role like never before, and they were seen as the leaders of the hospital through this. It's always been that way, but never been acknowledged. So it was just amazing. It was just unbelievable.
And not only leading, but walking beside and being on the closing end of things. There's not a part of this process where they haven't been present and contributing and leading.
There's a newfound respect, and there's a newfound partnership, and there's such great teamwork happening, and it's phenomenal.
Indeed, remarkable what visibility and being seen will do. And I don't get to say this very often, but we see you now. When I think about the process of how we were developing this podcast, that was some of the things that we talked about as far as this name, because we see you, and maybe certain problems haven't been seen, but that phrase of "see you now," it fits it perfectly. My goodness, yeah, it is. That is what it is. I see you now. I see all that you do, where before I don't think people really understood the role of nurses. I've heard nursing educators say that forever and a day. People just don't know what nurses do. Well, now I see you now. Nicole Lincoln is a nurse, innovator, and thought leader at Boston Medical Center in Massachusetts. She's the senior manager of nursing innovation, where she works with nurses to champion their innovations across the enterprise. When COVID-19 descended upon the Boston community, she was in the driver's seat of the rapid response and became the COVID innovation guru. She says in her characteristic Bostonian accent, like the best job in the world. Observing the problem-solving, teamwork, and fast-paced, high-volume innovation from a very close vantage point, Nicole concluded, the world is changed forever, and we're never going back. And for pregnant people and new babies, this might actually be a good thing. This spring, as countries around the world told people to stay home to slow the spread of the coronavirus, neonatal intensive care units were noticing something strange. Premature births were falling, in some cases drastically. NICU teams around the world, unaware of each other's work, found that during the lockdowns, low birth weight infants, especially the earliest, most dangerous cases, had dropped significantly. As researchers began digging into the data and sharing their findings, they heard similar anecdotal reports from colleagues in countries around the world. The causes of preterm birth have been elusive for decades, and ways to prevent it have largely been unsuccessful. They're not sure what caused the drop in premature births and can only speculate at this point as to the factors of lockdown. More rest, lower pollution levels, reduced exposures to other pathogens that might have contributed. If the trends in the data are confirmed, the pandemic and lockdowns could be something like a natural experiment that might help us understand why premature births happen and how to prevent them. As Nicole observed, it takes a pandemic to get so many ideas going that it's the silver lining of a catastrophe, one that forced us to rethink every step of care and solve it, quite literally, overnight. It's an innovation hotbed. For See You Now, I'm Shauna Butler. Thanks for listening.
Johnson & Johnson has always supported nurses as essential healthcare leaders and is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. Johnson & Johnson and the American Nurses Foundation are proud to have launched the Coronavirus Response Fund for Nurses. Go to the American Nurses Foundation website to learn more. And thanks.